Thank you very much. Thank you. Thank you. First of all, thank you, Dr. Clegg, and thanks to everybody at Hopkins and the Bloomberg School of Public Health for having us here. Dr. Davidson, Dr. Zeeland, Dr. Alexander, thank you. And to the panelists who will come behind me, I want to thank them, including Dr. Gail Saltz, the moderator, and Peggy Hamburg, who has done a brilliant job, I think, at the FDA. I'm very proud of her and grateful for her service. Senator Amy Klobuchar, Congressman Patrick Kennedy, Dr. Douglas Huff. I'm also bound to say, since I'm here at Hopkins, that my foreign policy aide, who also helps me on all of our international health work, Ami Desai, is a graduate of Hopkins. Therefore, he claims that you get a piece of every life he saves. And I want to thank Jenny Ehrlich, who runs our Health Matters initiative, started our effort against childhood obesity, and will soon be leaving the Clinton Foundation to work as our partner in the Robert Wood Johnson Foundation. None of this would have happened if it hadn't been for her. I will be very brief. The panel's too interesting and too knowledgeable for you to waste a lot of time on me, but I do want to say a couple of things and ask for your help in one way when they start talking. Everybody here knows that prescription drug abuse and misuse is now our fastest growing drug problem, although sadly, heroin abuse is catching up rather rapidly. I got involved in this, I'm ashamed to say, from a perspective of total ignorance. Until a couple of years ago, within a 10-day period, two young men, 30 and 32, whom I knew, died in their sleep after drinking 5 or 6 beers and popping an OxyContin. Both of them were given these pills by their lady friends who were totally ignorant of the biochemistry of what was going on. They just said, "This will give you a buzz." And it did, after which they fell asleep and never woke up. Neither of them was addicted to prescription drugs. And neither of them was trained enough in human biology to have any clue that they were about to deaden the portion of brain that told their body to breathe while it was asleep. And so they never woke up. One worked for Hillary at the time in the State Department and had worked for me and was in the George Washington University Combined Program in Law and MBA. One was the son of a Kosovar Albanian immigrant who lived across the street from me. One of 5 children, the only son. And so I got interested in this. And I wondered how many other people were dying either from addiction or ignorance. And we began to do what we could. As you just heard, this is now a year since we have been working on this. And I want to thank a lot of the partners we've had, but especially I am so grateful to the FDA for approving, I think within 15 weeks, some rapid time, a more efficient and user-friendly way to distribute Naloxone. Because it's clear to me that a lot of lives can be saved if we get the production up, the price down, and make it more user-friendly. Our foundation has been honored to work with the FDA and with a lot of other partners, including the people who manufacture this medicine, who recognize that at present volumes, it costs too much to be usable, and at present distribution methods is likely to be insufficiently user-friendly to save as many lives when you have a limited amount of time to save them. So I want to thank again all the panelists for the work they do on this. I want to thank the FDA and the White House Office of National Drug Control Policy. I want to thank the JED Foundation, who's been a great partner for us, and I want to thank Patrick Kennedy for all he has done to try to marry our passion for mental health programs that work and substance abuse programs that work. And I know there'll be a lot of talk about here about sharing best practices in the workplace and elsewhere on health and wellness. But I want to ask you all to think about this. Let's assume that the efforts we're making to try to find economically beneficial ways to drive down the cost of life-saving medication work. Let's assume that the FDA approvals mean there really will be easily understandable, much more user-friendly ways of getting the medications into the bodies of people who need it before they die. How do we do that? Our foundation has focused, ever since I left the White House 100 years ago now, on trying to answer a question that obsesses the public health community, but is almost never discussed in our politics. Our politics is a massive debate about what should the government do or not, and how much money should we spend on it. There is too little focus given to however much money you have and whatever you propose to do, how do you propose to do it to turn your good intentions into real changes in people's lives? This is not easy. Both of these young men died at home, in effect alone, because they were asleep. So we need help. We've allocated 3 years, but it makes me sick that we'll have to take 3 years to both get the economics right as we gradually scale up the use and figure out an effective distribution and use system that will at least catch the vast majority of people who would otherwise perish. So from my point of view, the most valuable thing you could do is tell me what we could do to solve that problem and to solve it in less than 3 years. There are a lot of lives riding on this. And if the trends in what we're seeing in heroin continue, there could be more and in more ways. There are other ways to deal with that. You can say whatever you want about that, but I'm assuming we've got this problem. I'm assuming we've got a life-saving answer. And I know we don't really have a clue to get the about how to get the life-saving answer to all the problems in time to save all the lives. And that's what I'm obsessed with. So if you can help us on that in very specific ways, I will be very, very grateful. And again, I want to thank Johns Hopkins, where the serious study of medicine began, and where so much good has been done for so long now. And I want to thank all of our panelists for their commitment. But all of you came here because you cared about this, and especially the young people. You need to tell us, what can we do to make sure that now medication that is theoretically able to save almost every life affected by prescription drug abuse can actually do that. Thank you very much.